Hello and welcome to this edition of Bayou Time. I'm your host, Keith Whiteside. Thank you so much for joining us. You know, we always like to get the opinion and the perspective of our local leadership. And as always, we appreciate Archie Chaisson, Lafourche Parish President. Archie, welcome back to the program.
Good to see you again, Keith.
I appreciate it. Well, you know, I'd like to say the numbers are better, but boy, they're not. Tell us a little bit about what's happening on your guys' end.
Yeah, I was kind of a little positive yesterday. We got our numbers. We only had 62 cases yesterday, which I was hoping, we had seen a downswing on the Monday numbers. It was less than what we had seen the previous Monday. And then we came through with 188 new cases today. Our weekly positivity rate had increased. Again, last week we saw a small drop, but this week we went from 17.5 to 18.0. So it's one, we continue to deal with it. Unfortunately, we've seen a couple of new deaths over the last week, which is still saddening. We continue to pray for those families as they deal with their loved ones. Some of them personally who I know that we're going to be attending some funerals this weekend, and it's going to be hard, but our prayers and thoughts are with those families. But it's something that we're going to continue to grapple with, I think, unfortunately, Keith, as we get through whatever this next surge is. As we see hospitalizations kind of fluctuate, we had kind of seen a decrease in hospitalizations over a couple-day period. They jumped back up again with today's numbers. 66 people in the hospital in Lafourche. Still 24 people on ventilators region-wide. So it's been a fluctuation. We look at hospitalizations by age. Those 30 to 70-year-olds are kind of where the key indicators lie. We've seen a small uptick in the pediatric admits. I did ask the question to the state today, because we don't get those numbers, but trying to figure out what the positive case counts are by age, so we can try to get a handle on where those positive cases are coming from. So I'm hoping they can answer that question for me over the next couple of days, and either add it to the data that we get every day from our partners at GOSEP, or how do we derive that data, either through the state's website, digging through their spreadsheets, or some other way. But hopefully this thing gets better before it gets worse.
Yeah, and we just need to really start practicing again the right way to do things. There's the mask mandate once again, but you mentioned something. We're doing the same thing you are. I've had this hit closest to home. One of our extended family members died yesterday, and so we're in the process of making funeral planning, much like you are, and that's just kind of where we are. And it's one of those things that we want to let people know that. Again, we found that the best way to slow this down is by vaccinations. And can we talk a little bit about how things are going with that over in Lafourche Parish?
Yeah, just like everywhere, I think since this Delta variant has kind of kicked up, and we've seen the case counts rising, and it's I guess by better means caused the vaccine rates to try to tick up. We're now at about 30. When I looked at it yesterday, we were at 34.8. We've probably gone up a little bit more if they updated the dashboard today. So between that, we're at about 15%. If you want to look at herd immunity, people like to talk about those numbers. We're about 15% there. So we're pretty close to that halfway mark. Looking at getting a little over that 50% mark, either through people who have had it in the vaccine. But look, I think if you look at some of the medical reports, and there's differing opinions on this. If you've had if you had COVID last spring, the antibodies aren't as strong, so vaccines are still the best thing. And we've seen a lot of that being polarized. I get messages every day where we go back and forth with people about the vaccine, and still we encourage it. I think it's a great thing to do. I've talked about this before. I've got to meet the guys who developed it. I've got to meet the guys from the FDA who quality controlled it. Around Christmas time when the emergency use authorizations happened, when the vaccine first started to roll out through Operation Warp Speed. So I'll look at it a little bit differently. I think a lot of the medical professionals across our area are recommending it to their patients. But at the end of the day, it's a decision between you, your doc, and God. It's one of those things that we actually take seriously, and going to be the quickest way out of it, no doubt. Masks are only going to get us so far. Social distancing is only going to get us so far. But like we've seen with polio, with measles, and all these other vaccines that have been created since my grandparents were younger, we've eradicated worldwide diseases by vaccines, and this is no different.
Yeah, and if, Jason, you could put those Louisiana COVID numbers as of 8/18 back up, it's really interesting as you mentioned that. Down at the bottom of that, we talked about some of the statewide cases, 6,606, hospitalizations, 3,000, just over 3,000 statewide, COVID patients, 448 on ventilators, and statewide 87 deaths. I know we had recently just 4 in Lafourche and 2 in Terrebonne, but the one at the bottom is the one that always catches my eye, because that's the conversation we've been having in our family, and that those not vaccinated account for 89% of the cases, 80% of the deaths, and 91% of the hospitalizations. And those are not politically driven. Those are not anything other than facts that we're getting from the hospitalization, from hospital staff about what's happening. And so that's the reason why people keep hearing, go and get your vaccination and the options for that. I know there are lots of places in Lafourche that are offering that, and people can get a vaccination as soon as they want it.
Yeah, no doubt. We have free vaccines and free testing going on right now at the campus of Nicholls State University, not only for their students and their staff, but it's open to the public. You can visit our health units in Galliano or Thibodaux and basically walk in and get the vaccine or get tested, as well as all of our local pharmacies, our urgent cares, and even the big box pharmacies, Walgreens and CVS. And when you look at even our local numbers, Keith, you talked about those state numbers a minute ago, but of the 193 people hospitalized in our region, in the kind of 6 parish areas surrounding Terrebonne and Lafourche, only 16 of those 193 are vaccinated people. That should tell you something. It really should. The vaccine truly is doing what it's supposed to do.
Yeah, it's preventing people from getting too sick and preventing them from dying. Archie, we thank you so very much. We know how busy you are. We're so very thankful every time you make some time for us. So thanks again.
Good to see you guys, Keith. Take care.
Talk soon. And again, that's Archie Chaisson, Lafourche Parish President. Always very glad for his insight. Very well connected to bring us information through the government and in his connection with knowing and what's happening through the state. All right, we're going to take another short break. Don't go anywhere. A lot more Bayou time when we continue.